The exercise is a concentric focused lateral raise. The subject is in an athletic stance with feet about shoulder width apart. With a dumbbell in hand, the arm-forearm hand segment is abducted from 0 to 90 degrees. It is important that the upper body and lower body stay rigid. In this case, we will assume that the abduction takes place in the frontal plane about the anterior-posterior axis. However, in a real-life scenario, this motion would more efficiently be performed in scaption, or the scapular plane, for a more optimal alignment of the glenohumeral joint and participating musculature. As the arm is abducted, the humerus rolls superior in the glenoid fossa and glides inferior. The external torque during this movement is lowest at the starting position, as the weight is at the side and at 0 degrees of abduction. External torque is increased as the arm is abducted and the moment arm is extended. When the arm is abducted to 90 degrees during the lateral raise, the external torque is the largest. Here we can take a deeper dive into what's going on at a single moment during this open chain movement. In this instance, the segment of interest is the arm-forearm hand segment and is at a 45-degree angle. This diagram assumes a few things. Number 1, that the arm-forearm hand segment is fully rigid. Number 2, that all the muscles that abduct the arm compose one vector that accounts for all muscle force acting on the segment. 3, that the muscle force is in a single plane for 2D analysis. And 4, that the forces in this diagram are assumed to sum to 0 and be in static equilibrium. In this drawing, WR represents the resistance force, MF represents the muscle force, or the effort force, SW represents the force created by the weight of the segment, and JRF represents the joint reaction force. The coordinate system can be viewed in the upper right-hand corner. The internal moment arm is estimated to be about 12 centimeters, which is the point where the muscle force is acting. The external moment arm is estimated to be about 78 centimeters, which is how far the resistance weight is away from the axis of rotation. Because the internal moment arm is smaller, the muscle force vector has to be greater than the resistance force vector. Further, because the muscle force is between the fulcrum and the resistance force, this is a third-class lever. To make this exercise more difficult, we would simply increase the weight in the hand of the subject. Because this is a third-class lever, a small increase in the resistance force will require a large effort force to abduct the arm. To make the exercise easier, we would simply shorten the moment arm. Here, we applied weight above the elbow, which would decrease the amount of torque created by the resistance. If a client had arthritis and we wanted to decrease the compressive forces, we would limit the motion from 0 to 45 degrees. In this range of motion, the joint reaction force would be more perpendicular to the articulation surfaces. This would induce more shear force than compressive forces. If a client had more of a soft tissue injury and we wanted to reduce shear force, we would limit the motion from 45 degrees to 90 degrees of abduction. In this range of motion, the joint reaction force would be more in line with articulating surfaces. This would indicate more compressive forces. In either instance, because this is an open chain exercise, the amount of compressive forces are limited.
The exercise being performed is an eccentric shoulder abduction exercise where the arm is held out lateral to the body in a straight manner and slowly let down to the patient's side. The patient will stand with their feet about shoulders width apart and have a dumbbell in their hand. It is important that the shoulder and the arm are the only aspects moving and that the patient is not compensating with any other muscle, i.e., the other parts of the body should stay rigid. The arm-forearm hand segment will be held straight out while the patient starts at 90 degrees shoulder abduction. The patient will then slowly lower the weight to 0 degrees abduction while using the shoulder abduction muscles to resist the arm lowering to the side of their body abruptly. This exercise is an open chain exercise because the distal end of the arm-forearm hand segment is free to move and is not fixed to an object. From an osteokinematics perspective, this exercise is occurring in the frontal plane and is rotating about the anterior-posterior axis. While the arm is adducting due to the external force of the dumbbell overpowering the resistance force or internal force of the shoulder abductor muscles, the head of the humerus is rolling inferiorly in a clockwise direction and gliding more superiorly. The external torque created from the weight of the dumbbell on the arm-forearm hand segment is greatest when the shoulder is in 90 degrees of abduction. This is because the moment arm will be the largest in that instance, and torque equals force times the length of the moment arm. The external torque will be the smallest when the shoulder is in 0 degrees abduction. This is because the moment arm will be the shortest and the force of the dumbbell is through the axis of rotation, which causes no rotation. This will be better seen in the force diagram described next. The force diagram here is showing the segment of interest being the arm, forearm, hand segment at a 45-degree angle with the scapula. The joint reaction force is shown in blue labeled JRF. The red MF stands for the muscle force, the black S stands for the weight of the segment, and the green EF is the effort force. Also shown is the X and Y components of each force vector. We are assuming here that this is a single snapshot in time, so it is in static equilibrium. We are also assuming that the muscle force is the resistant force, that the weight of the dumbbell is the effort force, that the arm, forearm, hand segment is rigid, the forces must add up to 0 or cancel out because it is in static, and that the muscle force is a single 2D plane and all of the muscles abducting the shoulder act in a single force vector which is labeled MF. The coordinate system is also shown in the top right to show the positive X and positive Y direction. The internal moment arm, or the moment arm of the muscle force, is shown to be 12 centimeters, and this is the distance from where the muscle force acts on the segment to the axis of rotation. The moment arm of the effort force, or the distance from where the weight of the dumbbell acts on the segment to the rotation of axis, is shown to be 78 centimeters, which is larger than that of the muscle force. Therefore, the muscle force must produce about a 6 times larger force than that of the dumbbell because its moment arm is smaller and the torques have to equal out to 0 to keep it static. If the client has arthritis and you want to decrease compressive forces, then we would want to have the patient start at 45 degrees abduction and then lower the arm to 0 degrees abduction. By not allowing the patient's shoulder to be abducted further than 45 degrees, we are effectively making the joint reaction force more perpendicular to the arm segment, and the muscle force is also not pointed directly back into the joint, which causes more of a shearing force rather than a compression force. If the patient has a soft tissue injury and you want to keep the load on the muscle the same with less shear, then we would have the patient start at 90 degrees abduction and only go down to 45 degrees of abduction, which would keep the muscle force more towards the direction of the joint and allow the joint reaction force to be more in line with the segment of interest, which would create compression forces. You could potentially put a block at 45 degrees abduction to ensure the tension is taking off at that point to avoid shear forces. Lastly, this is a second-class lever because the resistant force, or the muscle force in this case, is in between the axis of rotation and the effort force, or the force of the dumbbell. To decrease the difficulty of the exercise, you could lower the weight of the dumbbell, which would cause less torque from the effort force. This is shown by using the purple dumbbell rather than the heavier blue one. This would mean that the resistant force, or the muscle force, can now be lowered because it does not have to produce as big of a torque anymore to keep up with the weight, which makes it less difficult. You could also bring the effort force or weight closer to the axis of rotation. This would make the moment arm smaller and decrease the torque created by the effort force, which would have the same effect on the muscle force as lowering the dumbbell weight. To increase the difficulty of the exercise, we could increase the weight of the dumbbell to increase the effort force. This would cause a larger force with a large moment arm, meaning the torque would be greater. Because the muscle force is working at a smaller moment arm, the muscle force now has to increase its force substantially in order to keep up with the effort force. This makes the muscle work harder to produce a larger force than it was before, which effectively makes the exercise more difficult. This is the end of the eccentric shoulder abduction exercise.
The exercise being described in this video is an isometric shoulder abduction hold against the wall. The subject will stand upright with shoulders squared, standing perpendicular to a wall. The subject will be about half an arm length away from the wall with arms lying to side. The subject will abduct their arm until it reaches the wall, beginning the exercise. The patient will press into the wall at this position for the designated time under tension the clinician desires. Due to this being an isometric exercise, osteokinematics is not applied because the bones are not moving during the actual exercise. However, to reach the angle position of the hold, there has to be abduction in the frontal plane about the anterior-posterior axis. Also, due to this being an isometric exercise, arthrokinematics is not applied because the joint is not moving during the actual exercise. However, to reach the angle position of the hold, the convex humeral head rolls superior relative to the glenoid fossa as a point on its articular surface simultaneously slides inferior. The static moment being studied in this force diagram is the moment of the isometric hold against the wall at about a 30-degree angle. This is considered to be a close chain exercise because the distal segment is fixed to the wall. The effort force in this case is the internal abductor muscles working to move the arm. The resistance force is the wall preventing the shoulder from moving into abduction, as well as gravity pushing inferiorly down on the segment. In this case, no force is winning because the segment is not moving. It is an isometric contraction. In this case, because the segment is not moving, the moments of greatest and least external torque are both at the same point. The segment of interest in this motion is the arm, forearm, hand segment as shown in the diagram. The forces that are present in this exercise are resistance from the wall, muscle force, joint reaction force, and segment weight. The external moment arm in this case is the whole length of the arm, and the internal moment arm would be only the length of about half of the upper arm. Thus, the external moment arm is much longer than that of the internal moment arm. The origin of the coordinate system is at the humeral head with the positive x-axis running along the segment distally and the positive y-axis running perpendicular with the x-axis superiorly. The lever being displayed in this video is classified as a third-class lever. The assumptions that are being made in this case include that the muscle force is in a single plane for 2D analysis, that the arm, forearm, hand segment is fully rigid, that gravity is considered to be impacting all objects involved, that all forces are equal due to no movement occurring, that only the distal portion of the arm is in contact with the wall, that all the muscle force is coming from the deltoid attachment, and assume we are looking at one image in time, static moment. To make this exercise more difficult, the patient could hold a dumbbell in their hand while pushing into the wall, increasing the amount of external force in the segment. Also, you could create a greater rep scheme, which is time against the wall, and a greater set scheme to increase the work the patient must do. For a patient that has arthritis, to decrease compressive forces, you could decrease the external moment arm. To do this, as the video is showing, bend the elbow 90 degrees and push into the wall at the same angle. This shorter external moment arm requires a lot less force than from the previous position. For a client with a soft tissue injury, to decrease overall shear, have the patient push into the wall at an abduction angle closer to 90 degrees. This position would increase the compressive forces, which in turn decreases the shear forces. Also, in both cases, to decrease overall stress, the patient could be instructed to push into the wall with less force, as an isometric exercise can be intensity controlled by the patient.
The exercise being described in this video is shoulder abduction lying in a supine position. The person will lie flat on their back on a table or plinth. To begin the exercise, they will simply begin to abduct their arm until they've reached about 90 degrees of abduction, making sure that they keep their arm rigid and their back flat on the table throughout the entire movement. The osteokinematics for this exercise is movement within the frontal plane about an anterior-posterior axis. During the abduction movement of the shoulder, the orthokinematics that occur are the humerus rolling superiorly and gliding inferiorly within the glenoid fossa. This is considered to be an open chain exercise because the distal segment is not fixed and is free to move in space. The static moment being examined in this force diagram is the moment that the arm has reached 90 degrees of abduction at the end of the movement. The segment of interest for this motion is the arm, forearm, hand segment. The effort force in this diagram is the shoulder abductor muscles working to move the arm throughout the range of motion. The resistance force is the weight of the segment, which in this instance is assumed to be the combined weight of the arm, forearm, and hand segments. Another force present within this diagram is the joint reaction forces that occur during movement. For this diagram, there is no gravity acting on the arm within this 2D examination because gravity is acting in an entirely different direction than the forces being observed. With how the axis is set up, it would be occurring in the z direction. Due to the fact that the effort force is between the resistance force and the axis of rotation, a third-class lever is being used by the body to perform the movement. The origin of the coordinate system is at the humeral head with the positive x-axis running along the segment distally and the positive y-axis running perpendicular with the x-axis superiorly. It is assumed within this diagram that no torque is being produced and all forces cancel each other out because it is a static moment. The external moment arm in this case would be the middle of the length of the arm, forearm, hand segment since only the weight of the segment is being moved.
The internal moment arm would be the length from the axis of rotation to the point of action of the muscles being used for this movement. External torque for this movement would be greatest when the shoulder is abducted at 90 degrees due to the fact that the external moment arm would be the greatest at this point in time. The external torque would be smallest at the beginning of the exercise when there's no movement, and the external moment arm would be the shortest and the force is directly in line with the axis of rotation. Some other assumptions that are being used within this diagram include that the muscle force is in a single plane for 2D analysis, the arm segment is fully rigid, gravity is not considered to be impacting all of the objects that are involved, all forces are equal due to there being no movement occurring, all the muscle force is coming from the deltoid attachment, and we also assume that we are looking at one image in time and the movement is static. To make this exercise more difficult, the patient could slide their body closer to the edge of the table, forcing them to have less support of the arm segment during the movement, leading to greater amounts of force having to be produced by the body. If patients are still finding that too easy, a dumbbell could also be held by the patient to add more resistant forces. To make this exercise easier, the patient could slide their body further onto the table so that their arm would have even more support, further decreasing the amount of forces that are needed to be produced by the body to conduct the motion since the weight of the arm is mostly supported by the table. For my exercise, there are not really many compressive forces or shear forces that occur during the movement since the segment is being supported by the table. This sort of counteracts the forces that would be seen as discussed by Josh, Colton, and Marcus. But most of the forces that would be seen in this movement would be depending on which form of the movement is being conducted. If the patient is performing the regular exercise or the regression, the patient would see more compressive forces to the joint simply from the muscles pulling on the segment. If the patient is performing the progression form of the exercise, then the patient would see more shear forces being applied to the joint from the segment being pulled down towards the ground by gravity.